Hello, my name is Frances Austin. I'm the diabetes dietitian at Royal London. Welcome to Healthy Eating with Diabetes and Pregnancy. So today we're going to identify foods that increase your blood sugar levels, understand the importance of a balanced diet and recognize ideal portion sizes, and look at practical ways to reduce sugar intake and portion sizes. So it's really important that you eat a healthy diet in pregnancy. So we don't want you to be hungry or over-restricting because your nutrition is important and so is your baby's. I'm going to talk about foods that affect your blood sugar and those that don't. I'm going to start with the starchy food group. Yes, so the first food group we have is a starchy food group, so everything in yellow. This is all, we call these carbohydrates, so things like bread, rice, pasta, noodles, so all the things we like. These are all healthy, so we don't need to cut them out, but we just want you to, because they convert to blood sugar, we want you to watch the portion size and spread them out. So imagine your car, the fuel for your car is gonna come from starchy foods, from blood sugar. So it fuels your muscles, your brain, and also for baby to grow. So we're gonna talk about watching the portion size and spreading them out. So of all the food groups you see, there are two food groups that don't affect your blood sugar. The two food groups that don't affect your blood sugar, that have no effect, are all your vegetables, apart from potatoes, they go in the starchy food group, and then also your protein foods. And these are things like beans, nuts, eggs, meat, fish, chicken, have no effect on blood sugar levels or minimal impact. All your vegetables as well, they have a tiny amount of carbohydrate, but they're really high in fiber, so you only absorb 50%, and they have a very tiny amount. So don't worry about vegetables, they're free. Apart from obviously potatoes, we'll talk about those in a minute. They go in the starchy food group. Okay. We have all the food groups that affect your blood sugar level. So as I mentioned, starchy foods affect them, but they're healthy. And then we have sugary foods that are refined carbohydrates. We'll talk about those in a minute. And those, obviously, we're talking about reducing. But you also have dairy foods and fruits, and they contain natural sugar carbohydrates, so they affect your blood sugar, but they're also healthy to eat. So we're going to talk about watching the portion size and spreading them out just while you're pregnant. So we're looking at portion size of fruit. So for example, fruit's healthy, so we want you to have it, but because it contains natural sugar, it can affect your blood sugar. So you want to watch the portion size and spread it out. So we say only have the portion that fits in the palm of your hand at one time. So for example, you can see the picture there, it's just in the palm of the hand. So like a banana, a normal but medium, normal large banana, that would be more than the palm of your hand. So you could have half the banana for breakfast, other half for a snack, or any fruit that fits in the palm of your hand. If it's more than the palm of your hand, that's too much fruit at one time. With fruit juice, we say, so a cup of juice and a cup of Coca-Cola, they have the same sugar content. So yes, the fruit juice is natural, but it's still sugar. So fruit juice is actually off the menu for pregnancy. What we recommend is any of the no added sugar squashes, or you can chop up fruit in water to infuse it. And in the supermarket, you'll find many brands in the supermarket. So things like anything that says no added sugar squash, you can have it, and they come in lots of different flavors. Also, you want to avoid things like smoothies because they contain a lot of natural sugar again, because you put lots of fruit in a smoothie, so they're also off the menu for the pregnancy. And dry fruit, you do want to be careful because it's very concentrated. So let's say you could have cranberry raisins, a tablespoon, maybe mix it with nuts. Nuts don't affect blood sugar. Or you could have 2 small dates with some peanut butter. But avoid the mature dates. They're too high in carbohydrate and sugar. They contain as much carbohydrate as a slice of bread. And other dry fruits, you'll tend to have too many. So you'd have like a whole packet of dried mango or the whole packet of dried apricot. So I would tend to do more fresh fruit over dry fruit. Dairy foods. So with dairy foods, recommend with the milk to do the green top semi-skim milk. You don't have to do skimmed milk. A little bit of that actually helps your blood sugar. If you're a bit underweight coming into pregnancy or have trouble gaining weight, I do the full fat blue top milk. But for everybody else, if you don't want to gain too much weight in the pregnancy, the best choice is the green top semi-skim milk. Cheese doesn't affect blood sugar, so if you like cheese, that's great, you don't have to put it on everything, but cheese won't affect your blood sugar, it's very low in carbohydrate. Yogurt, on the other hand, will, so we recommend plain natural Greek yogurt or low-fat natural yogurt with a little bit of fruit, chia seeds, nuts. I would avoid any of the regular low-fat fruit yogurts because they've taken out the fat and put tons of sugar in. So you can also try the diet yogurt, so things like Weight Watchers, Ski, Shape, Muller Light, not Muller Corner, or Activia no added sugar fruit yogurt. Make sure it says no added sugar. They have artificial sweetener in, so you can have those as well, but avoid the regular fruit yogurt because there's a lot of sugar in it. Okay, so now we have the two types of carbohydrates. We've got our sugary refined foods, and then we have our starchy foods that are healthy, yeah? So things like rice, bread, potatoes. So in the sugary food group, you can see we've got sugar that you put in tea and coffee, you've got fizzy drinks, you've got sweets, and you can see that pink line. So when you have anything sugary, it immediately shoots up your blood sugar really quickly and then it drops. Whereas when you have rice, pasta, noodles, you've got that yellow line, it keeps you fuller longer, it doesn't go as high. And when your blood sugar goes up that high, that's going to baby, can harm baby. And during the pregnancy, because of your pregnancy hormones, you can't tolerate anything sugary. So you do need to avoid sugary foods during the pregnancy because they'll really spike your blood sugars really high. You're just very sensitive to them. Yes, so you definitely want to avoid sugary foods during the pregnancy because they're going to spike your blood sugar. So we want to look at ways to limit sugar. So first of all, instead of putting sugar in your tea and coffee, use any of the artificial sweeteners, sugar substitutes. You find them next to the sugar in the sugar aisle. So they're things like Canderel, Splenda, Truvia, Stevia. And if you have a sweet tooth, they're quite nice because they taste extra sweet, so you don't have to use as much. So if you normally put 2 teaspoons of sugar in your tea and coffee, you need maybe 1 Canderel or half a teaspoon of Stevia. And then, yeah, or you can sprinkle it on your yogurt or cereal. Fizzy drinks, if I give you a cup of regular Coke, it will put up blood sugar, harm baby, but a Diet Coke won't. So any of the diet drinks, we're not saying they're healthy, but they won't spike your blood sugar and harm baby. So if you like Coke, Diet Coke, Fanta, Diet Fanta, lemonade, Diet lemonade. Anything that says diet, no added sugar, you can have it. In terms of biscuits, we recommend the plain ones that are low in sugar. So instead of chocolate biscuits, custard creams, you can have things like rich tea or ginger nuts. So you could do 2 rich tea or 2 ginger nuts, or you could have 1 digestive because they're a bit thicker, or 1 plain toast Bengali biscuit, not the sugary one, or 1 biscotti. Obviously more healthy would be 2 or 3 crackers with some cream cheese, peanut butter. That would be more healthy, more filling for you and baby than biscuits. Yeah. The next slide is starchy foods. So what we tend to do when we put rice, noodles, pasta, quinoa on our plate, any of the grains, we'll tend to put it all over our plate first and work our way up, and we end up with a big plate of rice, pasta, noodles, yeah? So take a wild guess, this big plate of rice, remember it breaks down into blood sugar. How many cubes of sugar is this big plate of rice equivalent to? And it is equivalent to 18 cubes of sugar. So you can see these 2 big plates on the bottom. That's that big plate of rice I just showed you, that 18 cubes of sugar. And that's the carbohydrate content at the top, not the weight of the rice. So that big plate of rice, the full plate, that's what we call carb loading when you're marathon training. So obviously no one's marathon training. So you just don't need that much rice. You're not gonna burn it off. That's just too much. But then if we go to the other extreme at the top, you'll see that tiny portion of rice, that's like a quarter plate of rice. That would be too little. That's over restricting your starchy foods. And we don't want you to do that to control your blood sugars because that can affect your nutrition and baby's weight gain and nutrition. So we don't want you over restricting. If you're doing that and your blood sugars are good, that's a big red flag that then you need to eat more, and then we probably need to start you on some medication because the first line treatment is diet, and then we might need to do medication if your hormones get stronger, yeah? So we want you to have the recommended portion, which is roughly that second picture, that 30 grams carb. That's a fist size of rice, or about 100 grams cooked rice, weight cooked, or a third of a plate rice, which is roughly about 50 grams carb, about 160 grams cooked rice. So if you, at the bottom picture, you're having those big plates of rice, that fist size might not be enough, so you can do the third of a plate rice, so between those 2. If your blood sugar's high on that portion size, that means it's your hormones, not your diet. And if you have frequent high readings, to contact the diabetes midwives, they can review you then to start medication. With the rice, we recommend obviously brown rice. If you can't do the brown rice, do the long grain white basmati rice. One recommendation is to change how you plate your food. So divide your plate into thirds, put your protein a third first, or some beans or protein, your vegetables a third on the third, and then the last third put your rice, pasta, potatoes, so it has less room to go. And you can also mix vegetables into the rice or the pasta. It looks like you've got more. And also remember, we're going to talk about snacks in a minute. You can have a snack 2 hours later, so you don't have to load up at the meal. In fact, we don't need to have a big meal, then you have a high blood sugar. Rather, you have a smaller meal, a third of a plate rice, and then you've got the snack later. Then we talk about starchy food servings at meals. So in your book, you've got the Healthy Eating with Diabetes in Pregnancy. On page 6, you've got a list of the starchy food servings. It all has 1 serving listed there. So for example, 1 slice of bread is 1 serving of a starchy food. So for meals, you can double it. You can have 2 servings of starchy food for meals and 1 serving of a starchy food 2 hours later for a snack. So for example, you could have 2 slices of bread, like we show on here, 2 slices of bread for breakfast, and then with the eggs, and then you could have 1 slice later for a snack with some peanut butter or cream cheese. You could have a sandwich for lunch and 2 slices with your dinner, with your protein and veg. With the bread, wholemeal bread is just brown colored white bread, so we recommend you do whole grain, whole wheat, granary or rye. Again, if you do brown rice or whole wheat pasta or brown bread, it doesn't mean you can eat more. You still want to keep that same portion size, the recommended portion size. For crackers, you can have 2 to 3 crackers as 1 serving, so you could have 4 to 6 for the meal, 2 to 3 for a snack. For potatoes, 1 medium baked potato would be for the meal, so half a baked potato is 1 serving, so you could have a whole baked potato for the meal, or sweet potato, or 4 or 5 small potatoes. One thing with potatoes is I wouldn't put them in your dish. So if you're having sort of rice or other starchy foods with the meal and you've got potatoes in your main dish, that's going to load up the carbohydrates. It's too much. So just replace that with some chickpeas or beans, or just leave the potatoes out of the main dish, and you can have them, on the side, or whatever starchy food you're going to have on the side. If you have yams or plantains, 2 egg-sized pieces of yams or plantains, because they're very sweet. So you can see that may not be very filling at your meal. So you may want to maybe forget having those and just choose rice or some pita bread or something that a little bit more filling. With pita bread too, half a pita bread's 1 serving. So you can have a whole pita bread for meal, half for a snack with some hummus, veggie sticks, for your snack. And with chapatis or rotis or tortillas, you want to do sort of more of a medium-sized one, whole wheat, and a tea plate size one 2 hours later for a snack. So you can have 2 medium chapatis for the meal and 1 small one for a snack 2 hours later. Just avoid the really big wraps, the naans, the parathas, anything French bread, bagels. They're just too thick, too high in carbs. So you kind of want a thinner bread, and not a big wrap. So with cereals, you can see on the slide, the worst offenders are going to be anything Honey Nut Crunch, sugar-coated, Cocoa Puffs, even Rice Krispies and cornflakes. They don't taste sweet, but they're really high in sugar, low in fiber. These are immediately going to shoot up your blood sugars really high and go to harm baby. So they contain lots of sugar and like I said, very low fiber. So with cereals, and also the worst time for your blood sugars that you're most sensitive is first thing in the morning. So I'd recommend either the healthy ones like Weetabix, 2 Weetabix, plain porridge. You can use artificial sweetener to sweeten it, or a little bit fruit, chia seeds, nuts, fruit and fiber, all bran, and then there's some in the middle. So like I said, maybe no added sugar muesli. Don't do granola, it's really sugary. To be honest with you, all the cereals contain sugar and they can all be a bit tricky in the morning because you're going to add milk, maybe fruit. So if you find that any cereal you're having, porridge, Weetabix, you're having a high fiber cereal and your blood sugars are going high, maybe switch to a savory breakfast. You might get better blood sugars that way, like a sandwich or eggs and toast, or some Greek yogurt, a little bit fruit. But I probably avoid cereal if you start to see it spike your blood sugar, because like I said, the most sensitive time is first thing in the morning when your hormones are highest. All right, now we go on to snacks. So we're almost done. So with snacks, we recommend you can have snacks 2 hours after the meal. You can have up to 3 snacks a day, so like a mid-morning, mid-afternoon, and evening. And because you're not having as big a portion of starchy food at meals, you're likely to be hungry in between. So that's when you can have a snack. But definitely wait for up to 2 hours, because that's how long it takes to digest your food. But We'd rather you avoid having a big meal and no snack, because that would be big meal, high blood sugar. A smaller meal with a snack later will give you a better blood sugar. Also helps with things like heartburn and reflux, which is really common in pregnancy. So with the healthy snacks, you can see we've got handouts for that in your QR code. There's the snacks for labor, and that's also the same for pregnancy. But these snacks here, what we recommend is you can pick one item from column A, the carbohydrate snacks. So for example, a piece of fruit, a slice of bread, half a pita bread, and you can combine it with any of the items in column B, the low carb, no carb snacks. Those ones you can have at any time. Personally, I would combine them. So you could have fruit and nuts, crackers and cheese, half a pita bread with hummus, some toast and an egg. So again, you can have these up to 3 times a day with a 2-hour gap after the meal. So yeah, mid-morning, mid-afternoon and evening. With exercise, you don't need to go for 1-hour marathon walks every time you eat. It's not the main way to control your blood sugar. Obviously it helps, but it's an additional tool to help you. It's more the portion size of starchy foods at the meals that's going to determine your blood sugars. So for exercise, we recommend 30 minutes a day. They could be broken up into 3 10-minute segments. So just a little bit of movement after you eat will help. And if you don't want to go out, it's dark in the evening, then a little bit of housework or movement after you eat is fantastic. So 10-15 minutes is fine. Make sure you don't get out of breath, and you can increase it gradually. If you want to be more active than this, you're welcome to do it. But like I said, don't try and eat a big meal and then walk it off for an hour. It'll only reduce it by 1 unit. So the main thing is like portion control, but a little bit of movement after you eat is definitely a good idea. So now we get to some questions. So I'm going to ask you a few questions and then I'll answer them as well. What food groups affect your blood sugar levels? So first of all, we have the fruit group that affects blood sugar levels. So everything in the fruit group affects it. Then we have our dairy foods, apart from cheese, so things like milk and yogurt, so cheese won't affect. And then we have all of our carbohydrates, our starchy foods, things like rice, bread, pasta, noodles, yeah? Should we cut these foods out of our diet? No, we want to, because they're all healthy. You and baby need them, so we want to watch the portion size and spread them out. So what's the portion of fruit? We say a portion of fruit is that only fits in the palm of your hand at one time. So if it's more than the palm of your hand, that's too much fruit at one time. And what's a portion of rice, pasta, noodles? It's a fist size or a third of the plate. So main takeaway, it's not a full plate, it's not half a plate, it's a third of the plate. So fist size or third of the plate. And then instead of fizzy drinks, you can have diet drinks that are regular Coke, regular 7-Up. You can have diet, so diet 7-Up, diet Coke. Anything that says diet, no added sugar, you can have it. Instead of fruit juice, you want to avoid fruit juice and have the no added sugar squash. Make sure it says no added sugar. Instead of chocolate biscuits, custard creams, you can have plain biscuits, things like ginger nuts, Ritz tea, 2 ginger nuts, 2 rich tea, or 1 digestive. Obviously, more healthy would be 2 or 3 crackers, rice cakes with some cream cheese, peanut butter. Instead of regular yogurt or low-fat fruit yogurt, you want to have diet yogurt. So you can have the Activia, for example. We're not promoting any brands, but I'll give you examples of it. So any low-fat fruit yogurt that says no added sugar, you can have. Other diet yogurts are things like Weight Watchers Ski, Shape, or Muller Light, not Muller Corner. And the healthier version would be some low-fat Greek yogurt with a little bit of fruit, or some plain natural yogurt. And instead of sugar in your tea and coffee, you can put any of the sugar substitutes. You find them next to the sugar in the sugar aisle, so things like Canderel, Splenda, Truvia, Stevia. You don't have to add as much, and you can sweeten your tea and coffee with that as well. Yeah. So remember, this is more of a treatment plan while you're pregnant. It's not the diet for the rest of your life. Obviously, it's a healthy eating plan. You can take on board a few of these healthy changes once you've had your baby. Hopefully things should go back to normal. Once you have your baby, the hormones go away, causing the diabetes in pregnancy, but we will test you to make sure it's gone away. So then take on board a few of these changes, follow a healthy diet, exercise to reduce your risk of getting diabetes later. Yeah. So remember, this is more of a treatment plan. So it is quite a strict eating plan while you're pregnant, to make sure you have a healthy baby and to keep your blood sugars controlled. However, once you've had your baby, you can take on board a few of these healthy changes to help prevent your risk of getting diabetes later, but it won't be as strict. So just take on a few of those. It is healthy eating plan. It will help you not gain too much weight in the pregnancy, which is good. and it's very healthy. Make sure too that if you do get any high readings, so remember this is a first line treatment, so if you go away today and you're following the eating plan and you're getting high readings, circle it, write down what you had to eat, see if it's your diet. If you've had the recommended portion of starchy food, 2 slices of bread or a third of a plate rice, and you have a high reading, then that would be your hormones, not your diet, and contact the diabetes midwife. And then we evaluate you for second line treatment, which is medication. So I'll give you an example. You could have the same breakfast, lunch, dinner today, and in 2 weeks time, it could be high on the same food at the same time. That's because your hormones get stronger as you get closer to your due date. So it's really important that you're not hungry, that you're eating enough. And that again, if you get any high readings, have a look to see if it's diet. If it isn't, you're following what you're meant to, then that's your hormones, and contact the diabetes midwife. You have 2 or 3 frequent high readings in a week. Thank you for listening today, and I hope that you now feel less anxious and stressed about the eating plan, that I've helped to alleviate those fears. And obviously you need to eat, enjoy your food, and not be hungry, and we're all here to support you, myself and the diabetes midwives.